Hi, my name is Erin Rae, and I'm a dietitian here in Boise, Idaho. I run a private practice and I see a large variety of different patients, including those with autoimmune issues, PCOS, food sensitivities, GI disorders. And I see a lot of patients who have weight-related issues and blood sugar-related issues. For the sake of today's presentation, I'm going to go over some of the interventions and considerations that I use when working with patients who are overweight, obese, have insulin resistance, prediabetes, or full-blown diabetes. So we'll go ahead and get started. Diabesity refers to the continuum of blood sugar and insulin imbalances that cause everything from mild weight problems and a little belly fat to prediabetes to full-blown type 2 diabetes. It affects 1 in 2 Americans, 1 in 4 Medicare patients, and 1 in 4 teenagers. It also occurs in about 80% of those who are overweight. To effectively manage patients with diabetes, it takes a holistic approach from a team that can address pharmacology and surgery, medical nutrition therapy, exercise, and the psychosocial therapy. We heard a great presentation earlier about the benefits that surgery can provide for weight loss, and I will go over what I do as a dietitian with my patients to support their eating and lifestyle habits. So as a dietitian, my therapeutic goals are pretty straightforward. I want to promote weight loss, reduce insulin, and improve blood sugars. In defining successful weight loss, it was proposed that successful weight loss maintainers be defined as individuals who have intentionally lost at least 10% of their body weight and kept it off for at least 1 year. Unfortunately, research is showing that only about 20% of overweight individuals are successful by these terms. This can be very discouraging for both patients as well as anyone working with them, and to me it says that maybe we're addressing weight loss the wrong way. There's a lot to choose from when it comes to diets out there. If you look up weight loss or diet, you will get a large array of information. Many different diets and why you should follow that specific diet is being pushed. You can see why patients get confused. It's really all over the map. I would like to go on the record now and say I think there are a lot of different kinds of diets and meal plans that could promote nutrition, weight loss, and even blood sugar control. That being said, I've started trending toward lower carbohydrate diets as I find most of my clients do a lot better on them. For the sake of today's presentation, I'm going to be discussing low carbohydrate diets, what the research says, what's considered a low carbohydrate diet, and how do I formulate a nutritionally dense and nutritionally adequate low carbohydrate meal plan. You all remember the Food Guide Pyramid. It came out in 1992, and it really directed a lot of our nutrition recommendations. It encouraged grains and cereals, recommending 6 to 11 servings of those per day. Then up at the top, fats and oils were to be limited and being used more sparingly. Much of what drove the idea of a Food Guide Pyramid was the idea that the low-fat diet was the best diet for everyone. With the low-fat diet, it was thought that fat makes you fat, excess calories make you fat, and since fat contains the highest amount of calories, in order to stay energy balanced, fat would be the first thing to take out. It's been thought for a long time that high-fat diets are the leading cause of high cholesterol and triglycerides, and what we should be encouraging would be those whole grains and other carbohydrates like fruits, low-fat dairy, and starches. This was a quote from Mark Twain. "It's not what we don't know that gets us into trouble, it's what we know that ain't so." I actually stole this slide from one of the courses of my courses in the Integrative and Functional Nutrition Academy because it really stuck with me and I find it so pertinent to the subject. I've been doing this long enough to find many examples of things I once thought were true that turned out not to be the case. And it also tells me that we can look at things through a different lens to find a different pattern. So as I mentioned, much of what drove that low-fat diet was to keep people in calorie balance. However, we continue to discover that not all calories are created equal. In this study, for example, they look at what happens to metabolism as individuals lose weight using different diets. As people start to lose weight, we expect metabolism to decrease simply because there's less body mass. In this study, they noticed that the total energy expenditure of patients given a low-carbohydrate diet, their metabolism reduced by about 97 calories after the weight loss. Patients, however, that were on a low-fat diet had a metabolism reduction of over 400 calories. They concluded that this was equivalent to an hour of moderate exercise. And this is just one example that food really does take on more than its caloric content. Metabolizing different macronutrients results in different caloric expenditure. Different foods produce a different thermic effect. Here you can see that for every 100 calories of carbohydrate ingested, there's going to be between 5 and 10 calories of those expended through metabolism. For fat, that's somewhere in the middle, 5 to 15 calories are expended. And then protein, having the highest caloric expenditure, 20 to 35% of those calories will be expended. Another important factor when looking at diet is looking at what the food is doing to our insulin levels. Insulin is the primary regulator of fat storage. When insulin levels are elevated, either chronically or after a meal, we accumulate fat in the adipose tissue. When insulin levels fall, we release fat and oxidize it for fuel. So restricting calories and exercising, it might help some, but until we address the glycemic effect of food, it will be hard to sustain that weight loss long term. But if we can get insulin levels down through diet, we see increased fat breakdown and weight loss. When muscle and other cells stop responding to insulin, you get insulin resistance, where blood sugar and insulin levels stay high long after eating. You'll see weight increasing, especially that abdominal weight. You'll get elevated blood sugars and eventually leads to diabetes. It in itself is an independent risk factor for heart disease due to the effects of insulin on blood vessels, and it also promotes leptin resistance. Leptin is a very important hormone. It tells the brain to stop eating, signals satiety. It also signals the readiness to move. So when you get someone who's leptin resistant, they have insatiable hunger and reduced desire to move, which is a perfect formula for weight gain. So for many of the patients who I work with, they complain that they're always hungry and they're very tired. This is common with my patients with obesity, PCOS, insulin resistance, prediabetes, and diabetes. The direction of my nutrition therapy has to address this in order for the patient to have any long-lasting success with weight loss. This leads me into some of the newer diet trends. Some of the popular names I have listed, such as Atkins, paleo, and ketogenic diets. These diets are all a little different, but they do address insulin resistance and leptin. They typically focus on whole foods and foods that are going to be naturally lower in carbohydrates. The proposed benefits of a low-carbohydrate diet, there's very many of those. With a low-carbohydrate diet, it's been proposed that you'll see reduced insulin levels, increased insulin sensitivity, improved blood sugar management, reduced appetite, improved weight loss, reduced inflammation, increased HDL cholesterol, and reduced triglycerides. With all of that, of course, then you'll see reduced risk factors associated with metabolic syndrome and type 2 diabetes. So what does the research say? I have a lot of studies that we can go through, and there are a lot of other studies, but I did want to pick just a few that I thought kind of give a good picture of what the low-carbohydrate diet does when compared with a low-fat diet. This was the A to Z study back in 2007, which was a comparison of the Atkins, Zone, Ornish, and Learn diets. In this study, women assigned to the Atkins diet lost more weight at 12 months and experienced comparable or more favorable metabolic effects, such as improved HDL, triglyceride levels, and decreased blood pressure. There was also a little bit more retention at the end of the 1 year, where there was 88% of people who on the Atkins diet that could actually stick with it. This was in 2015, and it was a critical review and evidence base of research to compare low-carbohydrate diets with the standard low-fat diets, and it really pointed to the need for a reappraisal of our dietary guidelines. Within this review, they looked at the meta-analyses of studies comparing weight loss with low-fat diets versus low-carbohydrate, high-fat diets. As you can see here, you tend to see more of a weight change with that low-carbohydrate, high-fat diet than you do with your low-fat diets. Here they looked at what was happening with triglyceride levels when someone would be on a low-fat diet versus a low-carbohydrate, high-fat diet. And what you'll see is that triglycerides lowered more with the low-carbohydrate, high-fat diet in every single study. Here they looked at HDL levels, and in every study, the HDL levels increased the most with the low-carbohydrate, high-fat diet versus the low-fat diet. In a couple of studies where HDL still decreased in the low-carbohydrate diet, it did not decrease as much as it did in that low-fat group. This is a summation here of a couple of 6-month studies where the subjects were obese with diabetes. what you'll see here is that low carbohydrate diet really did produce the greatest improvement in weight, hemoglobin A1C, blood sugar, triglyceride, and HDL levels. Here is a meta-analysis of 53 studies that was put out by the Lancet Diabetes Journal comparing the long-term effect, so having a greater than 1 year follow-up with patients who had been on either a low-fat diet or a low-carbohydrate, higher-fat diet. What they found was that the low-carbohydrate diet interventions led to significantly greater weight loss than did the low-fat interventions, and they concluded that research really no longer supported a low-fat diet over other interventions for long-term weight loss. And then finally, in the last study that I picked, this was another meta-analysis comparing very low carbohydrate diets. So we will get into those definitions in a bit, but a very low carbohydrate diet means less than 50 grams of carbohydrates per day. They looked at those compared to individuals on a low-fat diet, and there was a minimum of a 1 year follow-up. Here they found that the very low carbohydrate diet resulted in significantly better weight loss, decreased diastolic blood pressure, and increased HDL cholesterol than did the individuals on the low-fat diet. So now let's go into what a low carbohydrate diet actually is. There is no technical definition for a low carbohydrate diet, but it's been widely accepted that it means that typically less than 30% of your calories are coming from carbohydrates. That could be a pretty big range, anywhere between about 20 to 100 grams of carbohydrates per day could still be considered low carbohydrate. When you break that into a meal, you're looking at about 5 to 35 grams of carbohydrates per meal. Fat is not restricted, it's usually encouraged on these types of diets, and protein may or may not be restricted. By contrast, if you were going to compare this to a low-fat diet, a low-fat diet would be having closer to 250 to 300 grams of carbohydrates per day. So that's a pretty big difference. If we were to break this a little further and go into the very low carbohydrate diets, which are better known as those ketogenic diets, you're going to see that only 5 to 10% of those calories are going to be coming from carbohydrates. That breaks down to about 20 to 50 grams per day. With a very low carbohydrate diet, you're going to see a reduction in appetite and food cravings, decreased blood sugar and insulin levels, and there's also going to be some therapeutic benefits such as neurological function, reduced triglycerides, increased HDL cholesterol. When you compare that back to that a little bit more liberalized low carbohydrate diet, again, that's going to be closer to 50 to 100 grams of carbohydrates per day. You'll usually still see a reduction in appetite and food cravings. You'll still usually see blood sugar and insulin levels improving. But with this, there will be a little bit more flexibility. So for some people, that might be easier to maintain long term. When I'm talking about carbohydrates, I am not talking about the fiber content in those carbohydrates. So I like to subtract fiber from the total carbohydrates to get a better picture of how much carbohydrates somebody might be eating. So the example given here would be broccoli containing 6 grams of carbohydrates, but 2.5 of those come from fiber, so the net carbohydrate total would be 3.5 grams. So what can a person eat on a low carbohydrate diet? It's not just butter and bacon and eggs. There's actually a wide range of different foods, as you can see pictured here. Let's go through some of those details. You can have fish, chicken, beef, pork, and eggs, non-starchy vegetables and greens. A wide variety of different fats are encouraged, such as avocado, olive oil, olives, butter, coconut oil, seeds and nuts, full-fat cheese, full-fat dairy. You can even have 85% dark chocolate. And then there's some limited amounts of berries, sweet potatoes, and beans, depending on a person's carbohydrate goals. What you can't eat seems a little obvious, but none of these foods in here would be really recommended for anybody who's trying to lose weight or improve their blood sugar levels. So this diet would be avoiding or limiting your sugars and sweets, breads, pastas, rice and other grains, potatoes, corn, fruit juice, and large portions of fruits. The first comment that often comes to me is that some of these foods are healthy, especially fruit. And so I always like to remind people how much sugar is actually in fruit, and that if they really wanted to still have some fruit, then a little bit of berries in moderation would still be low in sugar. Beans, they are high in fiber and protein, so in appropriate small portions they can sometimes fit. Really depends on that carbohydrate goal I've set for someone. And then foods with resistant starch like sweet potatoes or potatoes sometimes can fit with, as long as there's some caution on the portion size. And it does depend on what kind of carbohydrate goal I have set for someone. It can be a little bit scary for some of my clients that have been avoiding fat for decades. So I always try to recommend some of these well-known healthy fats to them, and I remind them of all the health benefits that you can get with a lot of these foods, just to alleviate the fear of starting to eat fats again. Protein is still a very important nutrient. It promotes satiety and increases metabolic rate. And I usually have about 20 to 30% of calories coming from protein. And that looks like about 1 to 1.5 grams per kilogram of ideal body weight for most people. So if their ideal body weight is 150 pounds, I would be recommending somewhere between about 70 and 100 grams of protein per day. It depends on their activity level. And many of the patients coming in to see me are fairly sedentary, so we would start at that lower range in the beginning. I have a couple examples here of some typical breakfasts that would be included on a very low carbohydrate diet. So one of the breakfasts that I eat probably 5 out of 7 days a week would be eggs cooked in a little bit of oil or butter with avocado, and then whatever leftover vegetable I might have from the day before at dinner time. You could also do keto pancakes with a 1/4 cup of berries and whipped cream, or it could be something simple like sliced turkey, tomato, and avocado. Typical lunches, a salad works well because you can top that with some sort of protein, some seeds, some avocado, and a little bit of oil. You can also still do a sandwich or a wrap as long as you're doing lettuce to wrap those. They do have a couple of low carbohydrate breads out there for people who just really want to be able to have bread here and there. Dinners can typically look like a normal dinner that you're used to. We would just substitute out some of those carbohydrate portions. So instead of rice, using cauliflower rice. Instead of using regular noodles, using zucchini noodles. Many of my clients are often very surprised at how satisfied they are from their low carbohydrate dinners. Now, when somebody is following a low carbohydrate diet, they typically aren't all that hungry, and so snacks really aren't quite as necessary as they might be on another kind of diet. That being said, I still have some patients who need to eat on the run or have too much time between meals, and I don't want them to be running off to a vending machine or hitting up a fast food restaurant on their way home from work. So I think it's important to just give them some ideas of some of those nutritionally dense low carbohydrate snack foods that they can keep on hand to prevent eating something that's off their plan. I am still a big proponent of fiber, and if one is not careful on a low carbohydrate diet, they might end up having a very low fiber intake. So I do like to educate about fiber. Fiber does have many benefits, including increased satiety, reduced caloric absorption, lower blood sugar levels, and then one of the most important things that fiber might do is promote a healthy microbiome, which we are still learning about today. Fiber really helps to produce a short-chain fatty acid that's called butyrate, and that's been linked with fat oxidation and blood sugar control. I won't be recommending the typical fiber foods you hear about like bran cereal or whole wheat bread, but rather some of these low carbohydrate sources of fiber, such as asparagus, avocado, berries, Brussels sprouts, green beans. You'll even see some dark chocolate in there, as it is actually a high source of fiber. These next two slides, I really just put in there just to cover all the bases. There are some metabolic conditions where a very low carbohydrate diet may be contraindicated. And then on this next slide, there are some health conditions where it may not necessarily be contraindicated, but I would like to have additional medical supervision and maybe taking extra lab work just to make sure that a patient is safe while they're doing their low carbohydrate diet. So in conclusion, diabesity really requires an interdisciplinary approach. The more hands on deck that can help a patient, I believe the more successful that patient will be. There is really no single diet that's going to be best diet for every one of your patients. What I think the most important thing we can do is meet the patient where they are and then make reachable, achievable goals from there. I think the research really is showing that a low carbohydrate diet has a place in helping patients with obesity and diabetes. And then finally, I encourage you to refer your patients out to a dietitian that can help them put together a nutritionally balanced, low carbohydrate meal plan. Often people don't realize that the insurance will actually cover a lot of the services with a dietitian. So it's important if you can refer them out to a dietitian, then it ends up being a win-win situation. I've left my contact information on there, and I really encourage you to reach out. And if you have any questions about this presentation, or you're looking for any other additional research or links, I'm happy to send those over to you. You're welcome to call me or email me, whatever is easiest. I really appreciate you listening to the presentation today, and thank you very much. I look forward to hearing from you.